right. Well, hello, everyone. Thank you all for joining, and I'm happy that I could join everyone again for this town hall meeting. Again, I want to give a great big thank you to the county administrator, deputy county administrator Amy Hendricks, county administrator Jason Molino, Frank Krupa, our public health director, Dominic Recchio, our public information officer. I know there's a different title, Dominic, so bear with me. And all the others who have been working diligently to make sure that we are bringing information to you every week in as real time as we have that information to help with the recovery efforts as we move along. It is particularly helpful for me to be able to join you this week, helpful in the sense that it gives me an opportunity on behalf of Tompkins County to once again highlight what has been happening in our country and in some respects throughout the world relative to the systemic racism that continues to permeate our communities. The killing, broadcasted, I would say, killing of George Floyd has set off a lot of conflict and conversation in our communities. We've had conversations before. This has just perhaps the straw that broke the camel's back. People have been patient. People have been trying all different ways to interrupt these behaviors. Mr. Floyd did not deserve to die. Not for $20. I was reading a Facebook post where my niece in Pittsburgh spoke of my nephew, who is a pastor of a church, reminding her of an incident where he took money out of the ATM and went to do some shopping and paid with a $20 bill, which was suspected to be counterfeit. He didn't mean any harm. And when I thought about that incident, I got the chills. Because like George Floyd, he perhaps could have been dead for paying with what was seemingly a counterfeit $20 bill. Turns out after police investigation, it turned up to not be counterfeit, and I'm thankful for that. This past Tuesday, the Tompkins County Legislature took time to talk about, to recognize, and in a resolution unanimously decried this killing, not just of George Floyd, but Breonna Taylor and every other Black and brown person in this country who, unarmed, were killed either at the hands of police, at the hands of white supremacists, at the hands of people who believe that they did not deserve to live. They decried what has been happening with COVID-19 and its disproportionate effect on communities of color, particularly the African American community. Our legislature took action that was more than just words. We've done this before, we've passed resolutions before, but this time around we felt the need to do more than that and invited the director of our Office of Human Rights, or department head, and the chair of our Human Rights Commission, and our sheriff to tell us what can we all be doing. They shared with us, our Office of Human Rights shared with us that they are planning on hosting community forums with citizens Black men alone, perhaps, because this really has affected our Black male population in a very serious way. With police, with law enforcement, those who are sworn to protect and serve, and those who are sworn to carry out the law in a balanced and fair way. And hope to have those forums where we can hear from community and we can hear from law enforcement, and we can all work together to figure out in this county what we need in community policing, what we need in serving and protecting each other. Not just paper and words, we also took the stance that we expect that there will be education and interrupting of systemic racism when we see it, hear it, and acknowledge it within our own county government, within our own employment streams, how we will be addressing that. Our sheriff showed up and we're thankful to him. And I know some community members are speaking out and saying, you know, only now this should have been in place. But sometimes it does take a national event like a murder of Mr. Floyd to make us look back at our policies and our procedures and consider what it is we don't have in writing. Might be something that we have that is just how we do business, but it's not in writing. And sometimes when things are not in writing, they're not enforceable. And so our sheriff took the bold step to immediately, with his fellow workers, the undersheriff and others, put in writing a policy about the duty to intervene, that when our law enforcement folks who work for the county see a colleague behaving in a manner that is unethical, that is inappropriate, that is excessive, that they will not just stand around like the 3 officers who stood around and watched the one kill Mr. Floyd, but they will intervene. It's not too late. And we appreciate our sheriff putting that in place. We also appreciate that the Sheriff's Department has also had policy around the use of excessive force and the level of which and when. And that policy is not just here's when you use force. That policy includes here is what you do first. Here is how you de-escalate. And that's what we should be looking for. So I want to thank our Sheriff's Department. And again, knowing that these are the things that our county legislature is looking for, not just paper and words. I also just want to take a quick moment to say to this community that I am proud to be living in Tompkins County, where citizens can stand up and protest and speak out and say what is on their minds when things like this, situations like this occur, and not be afraid. And I want to end by asking everyone out there, all of those who are out there who show up as partners and as accomplices. People who know me know I don't like allies because, you know, allies can pack up and go home. When you're a partner, you're in it for the long haul. We're shoulder to shoulder. We share equally in the pain. We share equally in the solution. And I want to encourage you to please continue to find ways, think of ways, use your privilege to lift up the Black and Brown community, to help us to get to that place of privilege as well. That is extremely important. And to speak out, to interrupt, to intervene, to stop in its track racism when you see it. Yesterday, one of the employees at GIA, Black male, who's just been hurting from all of this, said to me, I need my white friends to understand that they might lose friends and family when they stop them in their tracks, and be prepared for that. if you're serious about this work, you have to be full on. You have to be ready to embrace it day in and day out. Just like me and other people who look like me have to put up with the racism, the xenophobia, the hurt, all of it, moment by moment and day by day. So I want to encourage you to please speak out. And if you don't know, reach out. Don't ask us to do the work, but ask us to join you in the work. And we're happy to do that. We are happy to do that because this has to change. And I don't want people to stop folks from protesting and stop folks from speaking out and stop folks from doing what they need to do, because this is what needs to happen. Thank you for giving me this airtime. Again, thanks to the legislature, thanks to our staff, because I know within our own county government, we've been talking about this. Departments are allowed to have that space to be able to talk, to be able to explore what's going on and deconstruct what's going on themselves and check their own biases. Like, am I that person? What would I do in this situation? Thankful for that opportunity, and know that we will continue. For those of you who want to know what else is happening with the Sheriff's Department, we encourage you to also call to share your views, email. Also go online and check the Sheriff's Department site. Look at the policies. See if there are things in it that you would rather see differently, and let them know. We're open to hearing. Thank you. With that said, I get emotional around this, so please bear with me. I am going to invite our county administrator, because outside of the senseless and the historic and unjust killing of Black and Brown people, we still are dealing with a pandemic. And we still need to continue that work in reopening and getting our economy back on track. So Jason, I'm going to pass this over to you and invite your comments.
Leslie, thank you very much. Thank you for your words, for your leadership. I appreciate all that you've said and all that you've done. And it's we're working. It's been enjoyable working with you, and we look forward to working together in the future. You know, throughout the COVID-19 crisis, I've reminded our staff and the community that with challenge comes opportunity, and I believe that same applies to the ongoing crisis of institutional racism that we've witnessed over the past week and a half. We've seen our community come together to solve problems and support each other, and there's definitely urgency to use what we've learned to address racism as we move forward with the community. And this requires dialogue, and it requires action from all of us. And I know we're in a position to continue that and to support that. I think you mentioned this earlier, and I want to build on it. Tomorrow, Reverend Ken Clark, Director of the Office of Human Rights here in the county, will be on a panel co-hosted by the College Honor Program on Black people, racism, rhetoric, and violence. And we'll post the link in the comment section for all those that are watching. I encourage everyone to tune into the panel, follow our Office of Human Rights as they plan upcoming educational programs, and engage in dialogues with our friends and our colleagues about race and racism in our community. And what changes we need to move forward in a more safe and inclusive direction. So I just want to let people know that, and that Dominic will be posting that link, and encourage all folks to participate, not only in this, but as we move forward. This is not something that will happen in a 1 week. It's something that will happen over time, and we need to continue to focus on it. So thank you again for your leadership, Leslie. Shifting a little bit to the COVID-19 pandemic. We continue. First of all, I do want to say, we have done a remarkable job here as a community, and I think the community needs to thank each other and give themselves a pat on the back for what this community has accomplished through the response to this. We continue to see a low prevalence of this disease in our community, and I think that has a big part of the willingness of our community to collaborate and work together, respect each other, understand, educate each other, and understand the challenges. that it faces, and that's something I think the community needs to take a step back and pat themselves on the back for. We continue to participate in the daily regional control room calls on a daily basis. We bring questions up from Tompkins County, from our constituents, from our colleagues, to our state reps, and as things move forward, then they're moving fast now, moving faster than ever. We often are responding to updated guidance that we get from a day-to-day basis. And an example of that is just today we received guidance on graduation ceremonies for high schools. We've passed that on to our colleagues and our superintendents, and it's been posted on the New York State Department of Health website as well, and we'll share that with the chat. Yesterday, we received unannounced notice of restaurants and bars being able to open outside for serving, of course, with good spatial distancing and a lot of other requirements consistent with what we would expect, but that was unforeseen, as was today, the graduation. The day before that was that summer rec programs could open up, and that guidance should be coming. So things are moving quickly on a reopening pace. I do want to thank the public for being patient as we receive this information and push it out as quickly as we can to everyone. It can be frustrating. We understand that, and we want to work with all our community partners to ensure that you get the information you need and can be able to reopen at a pace that you're comfortable with, but also protects you, your employees, and the community that partakes. So that's really all I have to update on that. I know we have a series of questions. We will be able to get into some more detail, but I do also want to thank the community for keeping themselves safe and keeping everybody else safe. They've done a really good job, and they deserve to be thanked for that. So I will introduce Frank Krupa, our public health director, to take it on. I will mention, obviously, we are missing one of our colleagues today, Jay Franklin, director of assessment, who I think gets a lot of the reason why we get a lot of tune-ins and check-ins is they just want to hear from Jay. But he unfortunately had duty calls. He had some other assessment duties he had to take care of this afternoon. And we have Amy Hendricks, our deputy county administrator, on with us as well. But Frank, why don't you take it away?
Great, thanks, Jason, and thanks, Leslyn, for your words. Our public health focus for the last few months has been squarely on COVID-19. And as Jason alluded to, our community has done an excellent job. And I also want to extend thanks for all of their efforts in helping us flatten the curve and reduce the spread of the disease in our community. We've talked a bit about the demographics of the cases here in Tompkins County, and I've said over and over again that they align with the demographics of our population. But I think it's also important for me to acknowledge the health disparities and racial inequities that have been brought to the forefront in this effort to address COVID-19, perhaps not here in Tompkins County, but certainly in New York State and across the nation and world. We still don't know what the long-term impacts of the disease is going to be on our community, and it's important for us to keep in mind all of those issues as we continue to move forward with this. I think really, my goal and the effort has been to make sure that everyone in our community has the healthiest and safest life that they can, and that is across the board, whether it's COVID-19 or any other health disparities that we're dealing with in our community. So I really do appreciate everything that you said, Leslyn. As we continue to reopen, we do need to still be vigilant. And in every instance, the 6-foot separation and wearing a mask are kind of foundational to us being successful. Obviously, as different industries open, there are specific guidance for them to follow, but really at the, again, at the foundation is that separation and wearing a mask. Those two things are going to have the greatest impact on us preventing the spread of the disease. I've had a lot of questions about what's been happening to the disease as we've started to reopen and see people out and about and interacting more. Thankfully, our incidents have not increased dramatically. We've had a case here or there. We are certainly seeing more asymptomatic individuals test positive as we do more and more surveillance type testing rather than just testing of people that have symptoms. So the disease is still there in our community, although at very low levels. And we've done a lot of work to get to this point and weather this storm. So we just need to continue to be vigilant and patient, and again, follow those very basics of rules, keeping the 6-foot separation, wearing your mask whenever you can, and of course, washing your hands often. So thanks, Jason and Leslyn, and I'll turn it back over to you, Jason.
Well, I think I actually am going to jump in for a quick second and say something I forgot. And both of you sort of mentioned, Frank, you talking about reopening our community and economic impacts that, we want to continue. For me, nothing is ever totally dead in the water with government. So even if they haven't voted yet on a stimulus package, or we don't know what's happening with it, we do want to encourage everyone to keep bombarding your elected officials with phone calls. Martha Robertson would be very proud of me because I think I have the number to call, 202-224-3121. Ask for your representative, Tom Reed, Kristen Gillibrand, Chuck Schumer, everyone, and tell them what we need. Tell them we need the CARES Act. Tell them we need them to push, that we're getting some stimulus funds coming to our community because we all need it. We need our people back to work. We need our daycares open. We need so much. Our frontline workers need stuff. So please encourage and make that call happen. It has to. And on that note, I also want to remind you about filling out your census forms, 2020census.gov. 2020census.gov. Please make sure you fill out the form. We need to have everybody counted. I'm going to move on with some questions, and Frank, I'm going to start with you. With the unrest happening, and I think you mentioned this already, you talked about it across the county, people are gathering to protest, peacefully and otherwise. What do you believe will happen, if anything, with the virus? Do you have a concern?
It's a good question that we've gotten a lot this week, Leslyn. And, there's no way to know. Obviously, having folks together in groups is not ideal in this situation. I've been following the protests, and it does look like people are wearing masks and trying to keep separation. So we appreciate doing that. And we've also gotten a lot of questions about, well, if we can protest, why can't we go do this? Or why can't we go do that? And I think it's important to remember that we are still in a pandemic and we're trying to stop the spread of disease. We are trying to take a methodical approach and limit through the phases so we can understand how it impacts the disease. But sometimes there are things that are bigger than that. Right. And I think this is one of those moments where what's happening in our community and across the country and world is bigger than what we were talking about a week ago. While we still need people to take the precautions, and quite frankly, going slower in other areas allows us to have these types of gatherings because there's less other opportunities for the spread of disease. Right. So it's a hard question to answer. I know everyone wants to get open as quick as possible, and certainly I never imagined 2 weeks ago in the middle of a pandemic we would be talking about worldwide protests and how to address that. But it is the situation that we have, and quite frankly, I think it's appropriate, right? And it's what people are feeling and needing to show, and we support that. And we just want them to be safe. Wear those masks, stay 6 feet away, do what you need to do to have your voice heard. And we'll take care of the disease side of it.
Thank you very much, Frank, for acknowledging that there's some things sometimes that are just bigger. And yes, we have disease pandemic, but yes, we also have a pandemic named systemic racism. And it's been throughout our world for a very long time. So thank you for that. The other question that I heard is, and that you said, people are asking, well, why can't we and why can't we? Is the 10-person rule in effect if events are outside and 6 feet distance is maintained as well as masks are worn? Do people still have to only have 10 people?
Yes, yeah, we're still asking to keep the groups under 10 people, even with social distancing and masks. It's really about not wanting to bring, groups of people together where there's the potential for additional spread. And I know that's challenging, and I'm hopeful that as things start to open, we talked about outdoor seating at restaurants, we're gonna get more of those things back into our lives that allows us to get out and be around each other. But at least for the time being, we need to limit it so we can be sure that the steps that we're taking are not going to negatively impact the disease incidence in our community.
Thank you. And one more question for you, Frank. Is there any new state guidance, or can you talk about any state guidance on who can get tested at this point?
Yes, it actually expanded today. The governor has now included those people that have been involved in protests. So they are now eligible under the criteria to get tested. And I think also, since the last time we talked, phase 2 workers. So any individuals that are going back to work in phase 2 are also eligible for testing.
Thank you. I didn't hear that, so thank you for that. Jason, I'm going to switch to you. Thank you, Frank. Jason, what immediate long-term actions are going to be taken by the county to address systemic racism? You mentioned some things, but what immediate action do you think can be taken? Long-term action.
Well, and you know this, Leslie, because you're a big part of establishing and framing a lot of the policies that we have in the county. But internally, the county has a zero tolerance policy for the expression of discrimination. We encourage dialogue, the creation of safe spaces for that dialogue, and we push training and education with all the departments and staff. And I know just in 3 separate communications I've had with the staff already this past week, we continue to encourage our leadership as well as our employees to have that dialogue and create those safe spaces, particularly now when the events of the past week are impacting our employees differently. And we ask them to be patient with each other and understand each other's perspectives. Recently we've done things, and there's a lot of actions that we've taken that we will continue to build upon. For example, we do have a diversity, inclusion, and fusion team, which is it's a county team made up of county employees that was part of our recent climate survey. And they worked with departments across a variety of departments on diversity and inclusion and equity initiatives. This past year, I've changed the hiring process, particularly for leadership, and hope to transfer that down throughout the whole organization, where we bring unconscious bias training to our interviewers before they begin the interview process, and we remove identifying information through the application process of applicants, so there aren't unconscious biases as we go through the process. Those are just a few examples of things that we've done and we will continue to do. And as we begin to bring our folks together and continue to communicate through remotely, we'll continue to build upon the things that have helped bring a good positive culture to our organization. And I guess, from a global perspective or from a bigger perspective, Leslie, is, we're committed to bringing changes to processes and systems in the organization that have reflected systemic racism or biases. Challenging the status quo, understanding how things should be, not how they are, embracing that change is what I think will promote positive culture in the organization and bring about equity and inclusion in our workplace. So it's something that we will continue, we have, and we will continue to build on as we move forward. The one thing that I can say that's really, it's excellent about our workforce is they're engaged and they care. And there's never a shortage of interested participants to help move these types of initiatives forward, particularly when we're talking about diversity, equity, and inclusion in our organization. So I've had a lot of employees continue to stay engaged throughout the past 3 months, even though maybe we're not here physically, but they will continue to push that culture change as we move forward. And that's something that, is important to me as the leader of the organization.
Thank you. And as people are gathering in the protest, I imagine that, there's the potential for conflict because, somebody's not wearing a mask, especially for people who might not be participating in the protest and might just be passing through or whatever. have you all at the EOC or elsewhere talked about how community members can participate in nonviolent de-escalation during these conflicts? Any guidance that you've talked about that you care to share?
Sure. We have talked about this a lot. We've talked a lot about it with community partners. I think the first thing that people need to keep in mind is personal responsibility. So again, I wear my mask to protect you. You wear your mask to protect me. We need to all take a sense of personal responsibility. If we come at things from that approach, we will be able to, address and work with folks as we move forward. The second piece is respectful dialogue, and I think, you mentioned this probably several weeks ago, Leslyn, about respectful dialogue. It was a good context that you put it in, where we need to talk with each other respectfully. We also need to keep in mind that there are other things that may be preventing folks from wearing masks. There may be certain circumstances that we, on the surface, do not understand about the circumstances of another individual or individuals. And that needs to be a personal check that we need to think about when we go to approach these situations. And I think those, personal responsibility and respectful dialogue and kind of a self-check on what am I assuming when I see this? Is that necessarily the case? And how to approach it carefully is going to be an important piece as we move forward. Business owners, again, they have to think about consciously how they are going to address patrons that want to come into their place of business and need to comply with that. So I think we ask everyone to be thoughtful as they go through this. Think about how they would approach it, be respectful, and so far, we've had great success. The community, I should say, has had great success with this, and we want to continue that.
Thank you. So we've had all these phases of opening, and I know you're in the control room and hearing what's going on and what's next. How do you think phase 2 has gone thus far? And I know bits and pieces of phase 3 have happened, but when do you think we'll be moving into full phase 3?
Sure.
Any word on that?
So I think phase 2 has gone well for our community as well as the region. I know we just recently sent out to all of the business that have completed attestations of the reopening plans. Our PIO team, working with some of our community partners, economic development partners, have created a poster, an identification poster that they can post on the front of their business that is endorsed by us, that says, yes, I've attested to this. I have a reopening plan, to do two things. Number one, give the confidence to the businesses, but also give confidence to patrons that, hey, this is a business that has complied and is looking forward. So that's good. Phase 2, I think, has gone as well as it can be. We work, and Amy and the PIO team and the EOC works incredibly hard to make sure we're pushing out information to all the community partners as quickly as we can. I think that's gone well. Phase 3, I would agree, we are partially in phase 3 right now, although officially not. And this week has been difficult, I think, more than the most recent weeks, as there has been less forewarning of things coming and changing. But we're doing the best we can. We're staying calm as we go through the process. We're being diplomatic, and we are trying to give people the information they need to make the decisions they need to make. And that's the best we can do. And I think we're doing a good job at it. We're going as far as the extra distance that we can to provide the support to those organizations and businesses so they can answer their questions that they need to answer so they can get open safely. So phase 3, good question. I can tell you, based on last week, we should not assume it should be 14 days from last Friday. So I'm not going to assume that. There will be another review of these extended metrics in another week. All goes well. Hopefully it will be in the next, short coming days, hopefully in the next week or two, I could say. And we'll see what continues to roll out in the next week. But there is no set time frame. I think we just have to continue to be vigilant. Frank talked a lot about mask wearing, a lot about how we can practice the good practices, distancing, and so on and so forth. As long as we keep doing that, we're going to be on the right path.
Yeah. Yep. As a community, as you all said, we've really been doing well, so we should keep it up.
Absolutely.
And since you mentioned Amy, and she's looking all lovely up there in my screen, May I have a question for you very quickly? How has the operations, and you're the Emergency Operations Center's manager, how has the operation shifted as we've moved through, the reopening phases?
Yes. So I think there's this, the EOC has a little bit of elusiveness around it and what happens here. Really, the operations continue to shift moment to moment, and they have since the beginning. We really try to plan ahead, but often are in response mode to whatever may be coming down. So as we enter the reopening processes and the phases, we attempt to plan for it. And then, as Jason mentioned, sometimes those plans change right away, or sometimes we can implement the plans. The nice thing about working with all of the different partners is we're aware of what's happening in the community and what our community needs. I think that our team tries very hard to listen to our community, to understand what the culture is here and how we can depend on all of our different partners, and to take that into all of our plans so that we at least have the grounding in that. So when something shifts or changes, we have those community relationships where we can call and say, okay, we're moving, restaurants and bars are opening for outdoor seating in the next 12 hours. How are we going to do this? And we can also talk to people, and we've had some reach out to say, do I have to open? I'm not ready. And we can have that dialogue with them and talk about what they need to get ready and that it's on their time. So I think that's been a piece to all of this, is continuing to build those relationships and partnerships that we have in what we're calling blue sky times, as well as during all of these different crises that we are now facing, that we have that openness. And so that's been a major shift, is who our partners are and how we can work with them.
Thank you, and continue to be nimble because it's changing from moment to moment. So thank you all for that. Amy, you all mentioned that you got some questions that might have already come in from folks. I don't have those questions, so I'm going to turn it over to you to ask and get answers to some of the questions from the people who are watching and listening.
All right. Thank you, Leslyn, and thanks for opening us. So I do have a variety of questions, and Jason and Frank, I think most of these are going to go to you, especially since we're down Jay tonight. So we'll try to figure it out without him here. So the first one is really for you, Frank, and it's about advice that you may have for welcoming family members into our homes who have been abiding by the guidelines. What advice do you have?
Yeah, that's some good question there, Amy. Obviously, there's so many questions out there about how to move forward. This is one that comes up often, right? We've been away from family, maybe grandma and grandpa, or cousins, or good friends, and we want to get back together. And if we're staying in groups that are less than 10, we're using good social distancing and wearing our masks. It is okay to do that now. The one caution that I would offer is that we have vulnerable populations, our senior citizens, our folks that have underlying health conditions. So if you have someone like that living with you back at home, it might not be such a good idea to go visit others, right? Or if someone like that is who you haven't been able to visit, that falls into one of those categories, you might want to hold off visiting for a little bit longer, or find unique ways to see them without, having to get too close, or, potentially exposing them. I know it's hard to do, and we certainly we want to get back together as human beings and hug each other and our families and friends. And we're moving towards that. We just, we want to be cautious about those vulnerable populations and make sure we're making good decisions to protect them.
All right, Frank. I'm going to continue with a couple more questions for you. This one is about the developments of the virus or a vaccine. Have you received any new details on any developments around these two topics?
Generally, that's happening at the national level, and where we're finding it out the same way others are, as news reports are coming from the CDC and other places about development of vaccine. I think Dr. Fauci said it's possible that by the end of the calendar year, we could have an effective vaccine, and that would be amazing and would be super quick in the world of vaccine development. So, I understand that we want to get to that point because it gives us a bit more freedom to move back to more normalcy if we can create protections within the community itself. But we need to make sure we allow the science to develop and the scientists to work and find good vaccines. It's more important that we have an effective vaccine than a fast vaccine. So I get it. We just need to be patient, and obviously as soon as something is ready to go, we stand ready to enact our plans to make it as available to as many people as possible.
So a little bit more on COVID itself. It's been several months, and is there any more data on how contagious it actually is? The mortality rate and the likelihood of recovery?
Yeah, here locally, our incidence has been very low, as we've talked about. I don't think we've hit 170 total cases since this started yet. So it's hard to draw any conclusions locally, but we do obviously monitor the state and CDC and what they're learning about the disease. And there is still, an infectious rate that's more than we would want it to be. Certainly, we see folks in the hospital and then evolving into needing intubation. That's still happening on much smaller numbers. And then of course there is the unfortunate death number that you see the governor talking about each day. It continues to fall, but I think we still at losing 50 New Yorkers a day in the last few days. That's too many. And so, yes, the science is evolving. I think we know more about the disease, but it would be foolhardy to write this off as something that's no longer dangerous. We still need to take the precautions to make sure that, we can protect the most vulnerable amongst us.
All right, thanks, Frank. Jason, I'm going to ask you this next question. As we're in phase 2 in Tompkins County, is Tompkins County saying to adjacent regions, New York State and elsewhere, that we're open for business, leisure, tourism? Should people be coming here at this point?
It's a good question, because I think people are eager to go back to a lot of the activities that they were familiar with, and a lot of, and this would be pre-COVID, and a lot of the activities that are now, opening up as the weather turns better. I think it's a several part question. One is, our adjacent regions are in a similar position in terms of what industries and sectors are reopened. So that's positive that, let's be honest, there isn't a line on the road that separates us between one county and the other, truthfully, and we're such a mobile society that it's easy to move around. So from that perspective, it's good that our adjacent regions are in the same place we are. A lot of the leisure activities, particularly tourism activities, are really at a later phase in terms of reopening. But, we face this as a community, and we already have with our state parks. We have large state parks in our county. It's one of our great assets. You and I actually had a conversation not too long ago with the state parks director for this region. They keep in communication with us. And, we want people, I think it's the same comment about visiting your family. We want people to be safe. It's not practical to assume that everyone will stay home until a vaccine is distributed and implemented. So we want people to be safe. Are we out there advertising, come here? At this point, I don't think anybody is. And I don't know that I would encourage anybody to do that. If we continue down the path of being safe, of being a good, community following these guidelines and maintaining the low prevalence of the disease in our community, that alone may sell itself to a certain extent in attracting folks to say, you know what, I want to go there because we know it's a safe community. So, but I think that will happen over time naturally. So, there isn't anything right now saying we're trying to attract folks to come here from all over the state of the country. I think people that are naturally going to come here, they're going to come here for the assets that we have. And at the end of the day, we want them to be safe if they do come here. And I think as these phases start to slowly reopen, one of the nice things is our adjacent regions with us are in the same place we are, and we'll open collectively as a multi-region area.
Okay. Frank, I have a follow-up that just came in to that question from Jason is, if someone has a summer home in Ithaca from another place, how long should they quarantine when they arrive? Should they quarantine? So how does that happen if they're going to be coming here for an extended stay?
Yeah, it's another great question, Amy. There's not a requirement about quarantine, an official quarantine if someone travels to this area from another part of, say, New York or our surrounding geographic areas. What we would encourage them to do if they do come is consider, staying away from others for that 14-day period, to allow time for the disease incubation period if somehow they were exposed before they got here. But most importantly, always maintaining the 6-foot separation and wearing a mask when out in public. Those things are going to help just as much. So no requirement for quarantine. Certainly, as Jason said, that personal responsibility piece, if you're going to come here, try to have a plan where you're limiting the other people that you might be exposing, but always maintaining that 6-foot separation and wearing a mask.
All right. Thank you, Frank. Jason, more questions to you about our reopening. What does a store have to do before it can reopen? Do they need to tell a local government they are opening? And who decides on whether or not customers should wear masks when they come in?
Good series of questions. To answer the second one first, no, they do not need to notify local government that they are reopening. Any business that fits within the phase 1 or phase 2 sectors or has been part of any announcements as of recent will have guidance on the New York Forward website. They have to complete a new reopening template or reopening plan, and they have to attest through a form and a document online that they have to sign and submit online that they have created that reopening plan. It has met the guidelines and standards outlined by the state of New York, and that they will have that reopening plan available for inspection if requested. Those are the steps they need to go through. The guidance is very detailed and in certain industries very specific for folks. I think they give a good direction. So those business and sectors should go onto the New York Board website. I would also broadcast that any organization that is looking to reopen or has the ability to reopen and has not, New York Board website should be their primary resource, their first resource to go to identify what they need to do to reopen, including the template that they need to draft or create the reopening plan and what guidelines they need to follow, and submit that attestation. If they submit the attestation, we will be notified within a day or two, and we will send to them the poster endorsed by the county that basically says, yep, we've received your attestation and you can post this safely as for anyone to observe, for any patrons, employees, etc. It's just another way of confirming folks that they've done all that they can do.
Okay. And as far as mask wearing in stores, who decides that?
That's going to be part of their guidance, but I would say it's pretty safe to say that any employee or patrons in a store, if they cannot maintain the 6-foot distance, they're going to be required to wear a mask, which is probably every circumstance. So that's set in guidelines. It has to be part of any business's reopening plan, and they have to attest that they are going to uphold that. I will also say that I believe an executive order passed by the governor, issued by the governor, authorized business owners to not serve individuals that are refusing to wear a mask.
All right, thank you. Frank, we're going to talk a little bit more about testing. My first question is, do people need to be tested before they go back to work?
No. Other than hair salons and barbers, there was a requirement that those individuals have to be tested and then tested every 2 weeks. And we've had the mandate for nursing home employees and workers to be tested twice a week. Beyond that, anyone returning to work currently under one of the phases or as an essential worker is eligible for testing, but is not required to be tested.
And that would include wait staff and cooks. They're eligible but not required.
Correct.
Okay. When someone goes,
may I please ask Jason just to repeat something?
Sure.
Did you say that store owners do not have to serve anyone if they refuse to wear a mask? Is that what you said?
They've been given the authority through the executive order. That is correct.
Thank you. It wasn't clear, so I just wanted to hear.
Yep.
Thank you.
Thanks, Leslyn, for that follow-up. Going back to testing, what are the different testing sample types, and why are there different types? Is it just because they liked me better when I went to get tested than they liked you, or is there a real reason for the differences?
Yeah, as more people have been getting tested, we've been getting this question, right? They go and get tested, and they talk to a friend, a neighbor, a coworker that also got tested, and like, oh wow, they tickled my brain, and the other folks, they just went in my nostril a little bit. And it is important to understand that all of those sampling methods are approved and are equally successful in getting appropriate results. The reason that different tests, well, then you say, okay, well, why not just do the one where you just tickle my nose instead of, impaling me? Then it becomes the idea that we want, there are different ways to collect it. There are different supplies that are necessary to do the different types of tests. And this is still a fluid situation related to supplies for sampling. So some of it is on sampling availability. A part of it is about where the test is going to be run. So thankfully, Cuyahoga Health Systems has stood up a lot of local capacity, but when that capacity is exceeded, they are still sending out to other labs. And so depending on how many samples are being run in a day, they may have to take a different type of sample that's more readily compatible with going into a travel medium that allows the sample to survive for longer times, because it has to be transported to a lab out of town. So it's important for everyone to know, yes, you may get sampled differently, but the results are still just as accurate. And I joke about, the different types. And I know for some folks, it's a serious thing. And I certainly appreciate that. But please understand that every sample that's collected, the methodology being used is being used for a reason. Please, do your best to bear with us and, continue to get tested if you feel appropriate.
Right, thank you. As far as people coming back into stores, how do we know if a store has been disinfected or an office, how do we know that? And how are we communicating our expectations when visitors show up? Jason, do you want to take it, or Frank?
Go ahead, Amy, could you just say it again real quick? I'm sorry.
Sure. How do people know if anyone has disinfected a store or office, and how are those expectations communicated with visitors?
I think there's, Jason talked about that we have created signage that for an organization that has affirmed that they have a plan and are doing proper disinfection and other mechanisms, they can put that up. And then I think people can expect that that organization is taking it seriously and are doing the steps that they need to. But I think it's really about personal responsibility. Again, if you're going into a facility, try not to touch surfaces that you don't have to, right? Limit that contact. But I think our businesses are taking this seriously and will be doing the right things. Okay,
a question that came in about the three institutions we have here, the three higher education institutions, and how are they communicating, what communication is happening with those three institutions as they plan for the return of their students. Jason, do you want to talk a little about that?
Sure. So we have had consistent and regular dialogue with them on a weekly basis. I know Frank is meeting with them in multiple groups and different task forces that all three of them have put together. So I would say our communication has been really, really positive with the higher ed institutions. Cornell, Ithaca College, TC3, all have been open, willing to share their approaches as they go through their different planning processes. They're sharing information with each other. They're sharing it with us. They're allowing us to get feedback and input, and they're asking us about questions about how they can bring things back. So they are looking at a gamut of issues. Also, I want to let people know that I think it was the Independent Association of Universities or Colleges put out some specific guidance for higher ed to follow. SUNY is requesting specific guidance, I think, by the end of this week from all SUNY schools. So they have really taken this very seriously. They're working very diligently. They have multiple task force, each university or higher ed institution is, to try to address their return that's unique to them. And each of the higher ed institutions have a different landscape different atmosphere that they have to work within. And it's just really, it's been really positive to be a part of those discussions with them. And I know Frank has been very involved, as you, Amy, and I, in a variety of different conversations. So rest assured, I would say there is a lot of communication, probably the best communication circumstance that we've had. And I would say we're going to continue to work with them as they begin to finalize their plans.
All right. On the same topic of some of our students, when students come back, this is a very personal question. A person has a child who's a student at Cornell and has an apartment rented from June 1st to May 31st of next year. There isn't any rental relief, but what are the guidelines as that child returns and goes into their apartment?
Sure. So I know that all the higher ed institutions are working on trying to provide specific guidance to their incoming students. Their orientation processes will include a lot of that. They're talking about code of conduct discussions. So I would say where they're going to go, if they have questions specifically, call the administration departments for each of those universities, depending on where your student or your child goes. And they will have, I know, a variety of information to share with you, and probably a lot more to share in the upcoming weeks.
All right, thank you. A hot topic question, is there any new guidance around summer camps?
No.
All right.
It should be coming today, tomorrow, hopefully. June 29th is a possible reopening. But right now, as of now, no. And when we get it, we'll push it out.
And on the summer camps issue, many summer camps will not open. And what is the county's role in addressing childcare needs for people with children who are returning to work? And I just got a message in from our youth services director, Kate Shanks Booth. So I'm going to follow up because this question just came in, that the Youth Services Department has launched the 2020 Summer Youth Planning Task Force looking at that. And they formed 3 subgroups, one focused on programming and services, one on equity and access, and one to provide information and is a clearinghouse. It will soon be an update to all of this on the Youth Services website, and they've partnered with 211. So that will be, I'm sure, significant in helping with some of this. I don't know that it'll address all of the childcare needs, but it will help with some of this as we start to look at how we're going to work through this with, still no guidance, and that ability to start summer camp in 3 weeks is very difficult to do for anyone that's ever worked or ran a summer camp. It takes a lot longer than 3 weeks to make that happen. And I can see Leslyn fully nodding her head on this because it's very hard to make that happen. So we'll continue, as we hear more, I'm sure we'll continue to push that out. So the next question, Jason, is for you. And that is, what is happening with the county's budget? Our county not only provides funds to all of the departments and services we provide, but also to the community as a whole. Can you provide an overview, a brief overview on what the budget looks like for the remainder of this year?
Yes, I can do that. A brief overview is that we are expecting revenue shortfalls in some major areas, sales tax, state aid, and other revenues. That has required us to take some immediate action, which is expenditure reductions this year, discretionary spending, some capital programs, and unfortunately, we've had to furlough about 100 employees till the end of July. That's the immediate time frame for the immediate budget. As far as how it's going to end up, I don't know, because it's going to depend on how the economy starts to recover. And it's also going to depend on the state of New York and whether or not the state hands down cuts in state aid. But we're going to work diligently to try to minimize any negative impact that we can. Moving forward, equally uncertain in 2021, I have given some budget directions to department heads as well as supporting agencies to expect a reduction in local share, meaning money from the county or how we fund things. And I've also said that this is a starting point of discussion. It could change for the better if the economy responds differently. It could change for the worse if it doesn't. And unfortunately, that's all I can tell you right now because there's just a lot of uncertainty. I can also say we are working every week, every month to update that information. so we can make better decisions moving forward. But right now, that's all I have to offer, because that's all I know about it. And until we start seeing a better track record in the economy, we'll be able to make better decisions.
All right, thank you, Jason. Frank, this one is for you. It seems that we are doing really well not having an outbreak of the virus. What lessons have you learned from this wave that we will need to practice in wave 2, assuming there is a second wave in the fall?
Yeah, well, we've certainly learned a lot. I think the thing that jumps out the most at me is that if we tell our community what we need them to do, they'll do it for us. And so, we're going to continue to monitor the disease. If there's changes, we'll let the community know. We'll let them know what we think is causing those changes, and we'll ask them to help us change our behaviors in order to address it, so we can stop the future spread. And I'm confident they will. But again, people are going to get tired of hearing me say it, that 6-foot separation and wearing a mask is with us for a while. And if people can just continue to do that as we navigate through reopening and through the fall, and through a potential second wave, we're going to limit the impact on our community. And if for some reason we have an uptick, we'll be sure to communicate that and share what we might want folks to do differently.
All right, Jason, this is back to you. Across the country, there are many different levels of government who are all interacting to provide assistance during a crisis, as well as in non-crisis times. What are the differences in response from the county, city, villages, and towns? And are there different responsibilities for these groups? So how do they intersect as well?
We could have a whole virtual town hall on this topic alone. I think the biggest disparity, the biggest difference between everyone in this specific issue is that it's a public health related incident. So in normal times, blue sky time, so to speak, weather incident, we're all going to be responding similarly in that we may respond to the immediate incident, for example, a snowstorm. This issue is quite different in that the public health department is a key component to ensuring public health safety and security for the entire community. And towns, villages, and cities have a very limited, in certain instances, no responsibility over public health. So that's the biggest difference with this incident. That said, everyone should know we have weekly conversations with all our chief elected officials of town, village, and the city. We do that every Thursday. It's been going on since March. We share information throughout that process. We answer questions. They've been great conversations, and we work with our local elected officials and staff to continue to push out that information and help monitor those things. So again, in this particular instance, we've been very active, much more than probably in past circumstances. When it comes to finding certain resources, our emergency response department distributes those resources to those jurisdictions, information shared with those jurisdictions, and we continue to have a lot of conversation with them on a regular basis. So that's the primary difference. Right in this instance, we are the lead in terms of the response to the disaster, and that's all led in the operations with our public health department.
Right. Are other counties in the southern tier giving the same guidance as we are? Are we all moving together in this? Jason?
Yes, I think we are all moving together with this. I know we've embraced the approach that we are here to support our constituents in our county, in our region. That's evidenced with the Cuba Health Systems opening the drive-through testing location, which I think residents from over 30 different counties have come to get their test done here. And we support that because we understand that, again, Tompkins County doesn't end just at the border. When our region succeeds, we succeed. When our adjacent counties succeed, we succeed. So there has been a lot of collaboration across the region. I think we are a leader in a lot of ways, and definitely help lead the way for a lot of folks to follow. But we are an engaged participant, and we want to see all counties succeed in our region.
Okay. And as far as the regional control room and the conference group, are they discussing structural racism and the protests taking place in our cities and communities? Have they been at least discussing that? And moving that?
Yes, they've acknowledged it when we've discussed it. We've talked about all that's going on in our different communities and how it's impacted our communities differently, which is important. The state has actively offered any support and resources we need, and the conversation continues to be had with those leaders in that room, which is important. You've got a lot of county administrators, county executives, other staff, chief elected officials in on those conversations. So it is something that's being actively discussed and acknowledged, and also supported by the state representatives that are there supporting the regional controller.
All right. We've had one question that just came in that I'll read, and I'll actually answer this one because we've been working on this. This is there public health campaigns exist around ensuring that the college population are being responsible citizens? And I will say that our public information officers are working with all of our community partners, because it's not just our college population that we have to remind about social distancing. This is a new thing. And so we are working with all of 3 institutions of higher ed, as well as other community partners, to encourage this. And we are looking at a public health campaign or a community-wide campaign that provides reminders and as well as empowers people to really be okay with this and to talk to each other. I don't know if Frank, if you have anything to add to that, but that's my take on this. Is we are starting to look at this, and we'll continue to push out that messaging.
Yeah, and I think you hit on a key point there. Yes, obviously our higher eds have a big influence on our community, but this is a community situation, and everyone needs to hear the messaging. And so, yes, we're going to work with our higher ed partners and make sure that we have messaging as more people return to our community. But that message is going to be the same as we've been telling everybody else, right? And we all need to monitor our behavior, have that personal responsibility that Jason talked about, so we can stay healthy and safe.
All right, so I'm going to do a very lightning fast final question, and then I'll turn it over to Leslyn to answer the question and finish it up. So I'll start with you, Frank, in answering this question. With everything that's going on, what has been the most challenging part of your work in the past week?
Yeah, this has been a week, that's for sure. Everything from structural racism and protests to dealing with reopening of different industries that we weren't necessarily expecting this week, and everyone's kind of looking to the public health director and department to know, what do I do, right? How do I do this safely? Should we be doing this? And so that's been extremely challenging, but it's also been rewarding in that our community responds in almost every instance, whether it's the reopening of restaurants and having to communicate very quickly about outdoor seating, to those individuals that are protesting, that when you look at video and pictures or participate, all you see are people wearing masks and trying to keep 6 foot away. So yes, it's challenging, but it's rewarding to be part of a community that listens to your guidance and really takes it to heart. All
right. Jason, what is the most challenging part of the past week for you?
I think one of the most challenging parts of this past week, and it has to do with multiple issues going at the same time, issues of structural racism coming to the forefront, the continued pandemic, the communication and challenges that have come with reopening in terms of trying to push out information. The biggest challenge, I think, in all of that is, continuing to make sure our folks, meaning the staff, we're communicating amongst ourselves, giving them the reassurance, because everyone has been impacted differently with this perfect storm of issues that have come up, and making sure that I'm there, giving them the support they need, the confidence they need, and continuing to provide the right message to the organization and the community. It's been challenging, it's been tiring, but I would agree with Frank, it's been rewarding, because our organization particularly, as well as the community, I don't think is afraid to provide feedback, both good and bad, which is definitely, it's reassuring. So when you get that good feedback, it means that we made some right decisions. We at times extended ourselves and we're a little vulnerable, but that was okay because it made people feel comfortable and gave them the reassurance they needed. So, that's that's been a challenge, but again, I think it's given us reinforcement as leaders that we're trying to do the best we can, doing the right thing. So.
All right, I'm going to turn this over to Leslyn to respond to that question and wrap us up for today. So, Leslyn?
Wait a minute. You got to answer that question.
And I'm going to go right back to you and say,
Yeah.
the most challenging part of this week for you?
Oh, thanks, guys. You know, I thought Jay wasn't here. I could get away with it.
Nice try.
Oh, thank you. I think the challenging part is to see our community going through such a trying time, and not just our community, but the country. I mean, going through a pandemic in itself and changing how we do pretty much everything was difficult, and we responded, and I'm very proud of the ways that we responded and worked for each other. Then to be followed with kind of a reminder, I don't think this is a new thing, but a reminder of what is occurring across our country and has been for many, many years. And in such a way that it's allowed people to say what's unacceptable and what they won't tolerate, or what we're not going to continue to allow to happen here. That's been a challenge, because a lot of hurt and frustration and anger is being expressed through all of our community as well as our employees. And as we're still continuing to respond to one crisis, there's more happening now. And so I think that's been very difficult, and with the frustrations of not knowing what's going on every level, and knowing that there needs to be continual change, that's very challenging. So that has been something that has been pushing me this week. And again, there's a lot of inspiration, and there's a lot of strength and a lot of power in this community to go ahead and embrace the change. And while we're in government, which can be, you know, one of those barriers and built some of those structures, I do have a lot of hope for what we offer here, and that we're willing to go ahead and push on those structures and really make changes that need to happen and should have happened probably long ago, but we're not willing to just be complacent. So that gives me hope throughout the challenge.
Thanks, Amy. Thanks for that. I mean, it'll be no secret when I say that, you know, the fear and the pain and the hurt that continues to just sort of sit in my soul has been perhaps the biggest challenge for me. And looking at our higher levels of government for leadership and not seeing it has been even more challenging. When you have an entire country hurting, we need our leaders to step up, and that sense of hopelessness, like I can't do anything about it. I can't go and, you know, shake my legislator or my president or whoever and say, what's wrong with you? This country is hurting, do something. That has been the biggest challenge for me. And as a mom of, you know, young Black males, and feeling for my friends and families out there, what we're all going through. And although we're speaking about it, recognizing also that there's not necessarily that outlet, because we've done it, we've said it, we've cried, we've begged, we've groveled, we've done everything for years and years and years. And, you know, it's rough. So that has been, you know, the biggest challenge for me. You know, those two things followed by our county administrator showing up with his gloom and doom sort of budget, which is not his fault, although I'm not sure. But to think of what's going to happen for our agencies and for the services that we provide to the folks here who need those services. You know, what is it going to look like? How much are we going to have to cut? How deep is it going to go? That's rough. It's really rough to think about. And in everything that's going on, and in everything that's happening with, racism and oppression, still for me having to throw on my Superwoman cloak and come out and let's figure this out together and talk with Jason and talk with you and figure and the rest of the legislators and say, how do we manage this and how do we think future? So that has been an incredibly rough week, for me. Um, the police showed up at my door yesterday for something that had nothing to do with me. And I was shaking, like just nervously shaking, not because it was the police, but because there's just so much going on, out there. To wrap, I just want to give a shout out to the high school grads. We had some young people at Ithaca High School this week who, you know, walked across the stage, got their diplomas, put on their graduation robes. It wasn't what we wanted it to be, but they did. I don't know all of them, but particularly, and I know I'm going to be a little biased here and shout out, especially the Black and brown males who weather the storm with everything that's been going on and cross that stage. So many barriers against them, but they did. So shout out to them. I also want to recognize that this is Pride Month, and the legislature did pass a proclamation on Tuesday in honor of Pride Month. We can't get our federal government to do that anymore, but our LGBTQ plus citizens deserve to be highlighted and celebrated for the contributions they make to our community, to our country as a whole. And with Pride, I'm always happy every year when we as a legislature do that. Want to encourage people to continue to follow the guidance Frank and Jason have been talking about all this time, for keeping safe and stopping the spread of the virus in their community. We've done well. We need to pat ourselves on the back for doing well and keeping it under control, but we need to keep doing the same thing. Wash hands, hand sanitize, don't touch surfaces that you don't have to touch. Wear your mask when you're out in public. And, please, here in my office, we are, it's just a few of us working, but we're asking each other the questions every day. I mean, we've implemented that, symptomatic. How are you feeling? What's going on? Have you had a fever? Did you come in contact with anybody who's been positive? We asked those questions, and they're just like 4 of us working. And we also made sure that we, take our temperatures when we come in, because we never know, and keeping a log. And so I encourage, if you're able to do that as an agency. Frank alluded to earlier that a lot of people are showing up more asymptomatic and we finding more positive cases. And so we want to take all the precautions. And last 2 things is just to remind people that we're continuing the discussion on redistricting. Part of that discussion is about legislature terms. I know that the Government Operations Committee met today to talk about what's that going to look like so that it can be aligned with census and all of those things. Community, despite all the things that are going on, we want you to stay informed. We want you to show up and share your thoughts with us around those as well. And again, 202-224-3121. Call your federal government representatives and let them know that your municipality, your local governments need their financial help. Otherwise, we are going to be suffering financially, all of us, for the next 3, 4, 5 years. So we need that help this year, to bail us out. Similar to how the airline industry and big business got that help, we need it. So please make those phone calls. Thank you very much for joining us again. And thank you to the crew here for continuing to share information as rapidly as you've been doing with the community. and keeping us all informed and moving forward. Thank you. Take care, everyone. Stay safe. Wear your mask, always nearby, please.